This video will show step-by-step procedure for completing a continuous enteral tube feeding. Prior to the procedure, please be sure to complete the following steps.
I've assembled the equipment that I will need. I again need the irrigation tray with the 60 ml piston syringe. I have the Aspirate Plus connector tubing, and I have the Aspirate bag of the proper formula that's ordered for the patient, and I also have a marker so that I am able to write on the bag. The first thing that I want to do is the same with the bolus. I want to aspirate back to make sure that I have stomach contents coming up the tube, which I do. I'll then proceed to once again pull back and check the residual volume with the same guidelines as on the bolus feeding. If I have less than 500, as I do, I have 30, I am going to go ahead and administer that back to the patient in order to maintain their fluid and electrolyte balance. Clamping my tubing, I will then obtain my 30 mLs of water, and I will proceed to flush the contents back with the water. I will then clamp my tubing and put my plug in place. I need to then obtain my solution that is ordered. I need to put the date, time, and my initials on when I'm starting the feeding. And I will open my Aspirate Plus connector tubing. When the tubing is opened, you will note that there is a Y port, and you need to be sure to take the little end plug and plug it in tightly so that you do not have your gastric secretions and your tube feeding coming out the tube. The tube is ready in place. There is a slider clamp, and I do want to make sure that that is open. What I will do then is take off the purple cap and I will proceed to prime the bag, spike the bag, by turning in a clockwise motion. The end of the spike is very sharp. You need to make sure you're holding this very straight so that you do not puncture your bag. I will then proceed to prime my tubing. I will slide the drip chamber in place. There's a stretchy area on the tubing which does stretch around the little triangle port, and I need to stretch the circular area into place, and you will hear it pop in place, and then I just need to push my tubing into the groove. I then have my tubing ready to be primed. I will turn on the feeding pump. First thing I need to do is set the infusion rate. The infusion rate ordered for this patient is 60 mLs an hour. So I will hold my finger on the button until I get to 60. If I go over, I just need to click the decrease button until I get the proper rate. So increase and decrease will change your rate. I have an area for volume delivered. I do not have any volume delivered because this is a new feeding. I will then proceed to push the run hold button. This will run the pump at this point, and you can see the gears turning on the triangular area. and you will see the tubing start to prime. Once the tubing is totally primed down to the tip, I will then proceed to take the cap off, clamp my NG, and I will place the purple port into the feeding tube. Because I have my rate set at 60, I will then proceed to continue my feeding. At the end of my shift, or when I'm finished with the feeding, I need to obtain the volume so I can document in my I&O. I will place the pump on hold, so again I'll hit the run hold button, and you will see that the pump has stopped. I will get the amount of milliliters that has infused, and I will hit total reset, and that will reset that volume to 0. I can then resume my feeding, discontinue it, change the rate, whatever my physician has ordered. One important thing to know with a continuous tube feeding is that you do need to check that residual volume of the gastric contents every 4 hours, or if indicated, more frequently by patient symptoms. Remember, immediately before administering anything through the tube, including the tube feeding or medications, you need to flush with 30 mLs before and after. You will again monitor the patient's weight daily. You will perform strict I&O and measure the blood glucose as indicated and ordered per the physician. You will also need to make sure you carefully check your physician orders. Some physicians order specific amounts of water to be flushed down the tube rather than the 30 mLs, so you do need to make sure you are aware of that. The bag and system that we're currently showing is, once spiked correctly, this is good for 48 hours. Thus being very important that you do know and note the date and time that it was hung. You may see one more type of continuous feeding tube at the hospital, and that is the compact set, which also is compatible with this feeding pump. This system comes all in one, where you have the bag connected to the tubing. You still have your Y port that will need to be closed. You do have the same stretchy and drip chamber, and it will fit into the pump and be run the same. You fill this by unscrewing the top and putting the amount of supplemental feeding in. This can only be hung for 24 hours. You do want to write down the date, time, and initials, and also the type of feeding that you are giving this patient. And you always screw the lid back up. You will hear that because we have our pump on hold, you'll hear the alarm going off. And you can see it's still on hold. So once I've cleared that volume, I will just hit run hold twice and it will restart.
Following the procedure, please be sure to complete the following steps.